So, welcome guys to this another session on the thorax. So, we are into this week of 4th to 8th March and we are discussing the MCQs of thorax. This is the most comprehensive anatomy MCQ series which you will find on YouTube. I'm Doctor Ankit, the professor of anatomy, and welcome to our channel Human Anatomy by Doctor Ankit. The question says a 43-year-old woman is diagnosed with a mitral valve stenosis. Okay, so MS is the diagnosis. During physical examination, the first heart sound is abnormally loud. Which of the following heart valves are responsible for the production of the first heart sound? Basic question. Basic question. We all should know the lub-dub, the S1, S2, and we should be knowing that the S1 is due to the closure of the mitral and tricuspid valve, and the S2 is due to closure of the aortic and pulmonary valve. And therefore, you can easily go with the mitral and tricuspid option number C over here. Right? Basic question. I totally admit that. Let's see an image over here. The image is showing us all the valves over here. So here we can see the mitral valve located over here. That's the location of the tricuspid valve. That's over mitral. And here you have the pulmonary and the aortic areas over here, right? Having this respective valves. So let's move to the second one. Question says a 45-year-old lady presents to the clinic with hoarseness following surgical removal of the parathyroid gland to treat her hyperparathyroidism. Why? Okay, so she was having hyperpara and she got the parathyroid surgically removed. With visualization using a laryngoscope, the right vocal cord adducts to the midline, fine, but the left vocal cord is fixed in the paramedian position. So while you do put a laryngoscope, both the vocal cords should adduct, but the right one did okay, but the left one was fixed in the paramedian position. Now, which of the following nerves is most likely injured in this patient? Now, history of surgery onto the neck, parathyroidectomy, and then the left vocal cord is not adducting. Okay, it is fixed in the paramedial plane. So, which nerve is commonly injured? Now, while doing surgeries on the thyroid or the parathyroid regions, the common nerve that can be injured over here is the left recurrent laryngeal, and that will be our answer over here, the left recurrent laryngeal nerve. And it is a nerve which basically supplies all the muscles of the larynx. So, all the muscles of the larynx are supplied by this nerve, right? Except which muscle? Except we have an exception, that is the cricothyroid muscle. That is the cricothyroid muscle, right? So cricothyroid is being it's supplied by the external laryngeal nerve, a branch of superior laryngeal nerve. So here in doing surgeries of the neck, normally this nerve is injured, and you can see also why, because this recurrent laryngeal nerve. So this is the vagus nerve that goes down, and below the ductus arteriosus, it gives off over here the left recurrent laryngeal nerve that will again move up. So it moves up like over here. So as it has a thoracic course as well, it recurs from a low levels, therefore commonly injured in cases of surgeries on the thyroid. Plus, do remember that the recurrent laryngeal nerve is close to an artery. It is close to an artery. Which artery? The artery is the inferior thyroid artery, the main artery that supplies the thyroid and parathyroid. Inferior thyroid artery, the nerve, the recurrent laryngeal nerve, lies very close to the inferior thyroid artery. Remember that too. Fair enough. Let's see the next one. The following statement concerning the blood supply to the heart are correct except. So, what is wrong about blood supply to the heart? Options over here are the coronary arteries are branches of the ascending aorta. That's a true statement. Okay, so ascending aorta gives off the coronary arteries, the right and left, from the aortic, you can say the cusp. Then you have the right coronary artery supplies both the RA and RV, fine, because it goes through that area, you'll see. The circumflex branch of the left coronary artery descends in the anterior interventricular groove and passes around the apex of the heart. Now, which branch passes through the anterior interventricular groove? It is not the circumflex, it is the LAD, the left anterior descending, or also known as anterior interventricular artery, which is actually a branch of LCA, the left coronary artery. So, this statement, option number C. Third statement is wrong, so second also right, but this third statement, this is wrong, and hopefully that is our answer for this question. Let's see the last option as well. Arrhythmias can occur after occlusion of a coronary artery. Fair enough. So arrhythmia, because the coronary arteries, they supply the whole conducting system as well. So if there is any defect in the artery, it could lead to arrhythmias, right? So option number C is wrong. Let us see an image as well. So what actually happens is the aorta, as you can see over here, and slightly from here we have the origin of the LC and RCA. So LCA and RCA, they take origin from the ascending aorta. Now what happens is that the LCA will be actually behind the pulmonary trunk and behind the left auricle. Then the LCA is shown over here. This is the LCA, right? And LCA bifurcates into these two branches, one going over here, this is the LAD, and one going around or circumflexing around the left border of the heart, that is the LCX or left circumflex artery. So this LAD artery or the anteroventricular artery, this is the one that is running in the anteroventricular groove and not the circumflex. That was the wrong part, wrong option in the question. Okay, so you can see option number C. Therefore, that was the answer, simple as that. While the RC, you can see RC is running between the RA and the RV, and therefore it supplies both RA and RV. I guess that was our second option, right? The right coronary supplies both RA and RV. So you can see over here. Fair enough. Let's see the next one. A structure indicated with the X on the given axial CT scan is which of the following? Structure. Okay, so structure indicated by X, they are saying it's a CT scan, so we know it's an anterior, posterior, that's right and left. Now it's which, and they have given 4 chambers of the heart, so we know that it's the heart that is being shown to us. Now if you know the basic anatomy of heart, let me just try to make a thoracic cage over here hypothetically, and say imagine this is the midline, dotted blue is the midline. Just imagine for a second. Now if I make heart like this, this is the approximate location of the heart. What you need to know, and I hope most of you must be knowing, is that right border of the heart is right atrium, left border of the heart is left ventricle. The anterior major part of the heart is right ventricle, and here you have this groove, and so the left border of the heart becomes a left ventricle. Anterior major part, or you can say the sternocostal surface of the heart is mainly our what? Right ventricle. So anteriorly it is mainly right ventricle, right and left border by RA and LV. So whereas LA is on the posterior aspect of the heart, forms the base of the heart. So again I repeat, right border RA, left border LV, anterior surface RV, and behind you have LA. Now if you look over here, carefully, what we see, this is the anterior, this is the right and left, so see this is the anterior part, so this should be RV area. This is which border of the heart? That is LV, left border of the heart. This is which part of the heart? That is RA, right border of the heart. Where it should be the LA should be posterior. Now they're pointing over here. Now what do you think? It is going to which side? It is going towards the apex. See this area, this is the apex of the heart. This has to be the LV, the left ventricle. Do we have that in the option? We surely should be having option number D, LV over here. Let me show you an image as well. Look at the image. All your doubts should be clear now. Let me revise again. This is the anterior surface RV. You can see the bulk RV. That is the right border of the heart. Which chamber it is? RA. Left border of the heart, which chamber it is? LV. This is the apex of the heart. And posteriorly, base of the heart, we have the LA, left atrium. That forms the base of the heart. So remember these things, right? Let's see one more. Now during cardiac catheterization of a 60-year-old child, the radiologist notes that the contrast medium released into the arch of aorta is visible immediately in the left pulmonary artery. What is the most likely explanation? So there's a contrast which is going into the arch of aorta, and suddenly the radiologist see that it is coming into the left pulmonary artery. So contrast over here, suddenly over here. So obviously common sense is that there is some connection between these two. What is that connection? We all know what is this. This is the ductus arteriosus, which is very important in embryonic or fetal circulation, but obviously after birth it's not used. So it post birth it becomes a ligamentum arteriosum, but in some children the ductus arteriosus remains somewhat patent. In that case we call it as PDA, patent ductus arteriosus. That can explain that why the contrast which is being poured into the arch of aorta is coming to the pulmonary artery. Patent ductus arteriosus has to be the answer without a doubt, right? Here you can see how this patent ductus arteriosus, if I may show with an arrow over here, this is the arch of aorta, right? This is the whole pulmonary trunk, that is the left pulmonary artery, and this going behind the arch is the right pulmonary artery, and here you have this defect, the patent ductus arteriosus. Defect over here is patent ductus arteriosus. Okay, so that was all, and we will see you again tomorrow at the same time and some other more MCQs on the thorax. I hope you're enjoying. If you're liking this, like, share and subscribe the video. That's all. Thank you very much.